Welcome to our channel. In today's video, we delve into a topic that is both sensitive and deeply important, a subject often misunderstood or surrounded by unwarranted stigma. Our discussion is centered on the intriguing phenomenon of ejaculation, without seen particularly as it occurs in men over the age of 50. This topic is not only medically relevant, but also profoundly tied to emotional and relational well-being. First and foremost, let me take a moment to express my gratitude for your presence here. By choosing to engage with this content, you demonstrate an open-mindedness and commitment to understanding a nuanced aspect of human health and sexuality. It's this spirit of curiosity and acceptance that allows us to break taboos and foster meaningful conversations. Why this topic matters for many men in their 50s and beyond, as well as their partners. The experience of ejaculation without seen can be puzzling, concerning, or even distressing. However, it's vital to approach this subject with a balanced perspective. This phenomenon, often referred to as dry orgasm or retrograde ejaculation, is a natural occurrence for some and typically not a cause for alarm. It's our goal today to illuminate the causes, implications, and ways to embrace this change with wisdom and confidence. The natural evolution of the human body. As we age, our bodies undergo a host of transformations. Some changes are immediately apparent, like graying hair or wrinkles, while others, such as shifts in reproductive and sexual health, are less visible but equally significant for men. One of these changes may involve alteration in the ejaculatory process. Ejaculation without semen can stem from a variety of factors, ranging from natural aging processes to the side effects of certain medical treatments. Understanding these causes is the first step in addressing any concerns and cultivating a healthy outlook. Exploring the causes of ejaculation without Sean. 1. Retrograde ejaculation. A primary reason kind ejaculation without semen is retrograde ejaculation. In this condition, semen flows backward into the bladder instead of being expelled through the urethra. During orgasm, this occurs due to changes in the muscles surrounding the bladder, neck, and urethra. As these muscles lose tone or coordination with age, the pathway for semen can be altered. While retrograde ejaculation may sound alarming, it's generally harmless. The semen mixed with urine is expelled naturally during urination, causing no adverse health effects. However, for couples trying to conceive, it may pose a challenge that warrants medical consultation. 2. Medication side effects. Many older adults take medications to manage chronic conditions, such as hypertension, diabetes, or prostate issues. Certain drugs, such as alpha blockers and antidepressants, can interfere with the nerves and muscles responsible for ejaculation. If you suspect your medication is contributing to this change, consult your healthcare provider. Adjustments or alternative prescriptions may be available to mitigate these side effects. 3. Prostate surgery. Surgical procedures to treat benign prostatic hyperplasia, BPH, or prostate cancer, often involve modifications to structures critical for ejaculation. While these surgeries can significantly improve urinary symptoms and overall quality of life, retrograde ejaculation is a common side effect. Awareness of these potential outcomes allows for better preparation and acceptance. 4. Hormonal changes. A gradual decline in testosterone levels is a natural part of aging. Testosterone plays a pivotal role in regulating sexual function, including sperm production. Although reduced testosterone levels rarely cause ejaculation without semen directly, they can amplify other contributing factors. Consulting an endocrinologist may provide valuable insights and options for hormone replacement therapy if necessary. 5. Psychological factors. The mind plays an integral role in sexual health. Anxiety, stress, or self-consciousness about bodily changes can negatively impact sexual performance and experiences. Open communication with a partner and seeking guidance from a therapist specializing in sexual health can alleviate these psychological barriers, fostering a more fulfilling, intimate connection beyond the physical, emotional, and relational implications. Sexuality in later life often shifts from a focus on physical performance to a deeper appreciation of emotional intimacy. Understanding this evolution can help couples redefine their relationship and maintain a satisfying bond. Embracing emotional intimacy as the physical aspects of sexuality change, the emotional components become even more vital. Sharing affection, engaging in meaningful conversations, and cherishing moments of closeness can strengthen relationships and bring newfound depth to intimacy. Celebrating orgasms. Beyond Sean release. Contrary to common misconceptions, semen is not essential for achieving an orgasm. The sensations and emotional fulfillment associated with orgasm remain intact even when ejaculation is altered. Recognizing this fact can help remove undue pressure and allow for a more relaxed, joyful approach to intimacy. Strengthening relationships through communication. Open and honest. Communication is the cornerstone of any healthy relationship, particularly when navigating changes in sexual health. Discussing fears, expectations, and desires with your partner can foster trust and mutual understanding together. You can explore new ways to express love and sustain intimacy. Practical steps for managing changes. Seek professional guidance. If you experience significant changes or concerns about your sexual health, consult a healthcare professional. They can provide clarity, reassurance, and tailored recommendations. Consider lifestyle adjustments, regular exercise, a balanced diet, and stress management can positively impact overall well-being, including sexual health. Explore therapies, hormone replacement therapy, pelvic floor exercises, or counseling may be beneficial depending on individual circumstances. Educate yourself. Understanding the reasons behind these changes can reduce anxiety and promote a proactive approach. Encouragement for the journey ahead. Aging is a natural part of life, and with it comes the opportunity to embrace new dimensions of self-awareness and connection by approaching changes in sexual health with curiosity and positivity. Individuals and couples can deepen their bonds and continue to enjoy meaningful intimacy. Remember, the essence of sexuality transcends physical mechanics. It's about love, connection, and the shared joy of being present with one another. These elements endure, offering a source of fulfillment that grows richer with time. Additional thoughts. Building a supportive community. Engaging in discussions like this fosters a sense of belonging and breaks down societal taboos. By sharing experiences and insights, we create a more informed and accepting community, exploring new avenues of connection. Aging can inspire couples to discover alternative ways of expressing intimacy. This exploration can be as rewarding as the destination, enriching relationships with creativity and openness. Thank you for joining this important conversation. Your presence reflects a commitment to growth, understanding, and living life to the fullest. If you have questions or topics you'd like us to cover, please share them in the comments. Together, we continue to learn and thrive. See you next time.